My name is Gesine Paul. I'm a clinical neurologist at Lund's University Hospital, and I'm an associate professor in neuroscience at Lund's University.
What made you decide to become a scientist?
Well, I can say when I started studying medicine at university, I experienced this constant why and how. And this kind of followed me all the time. And it's this urge to find out how things work and why things are the way they are. And I had this dream or this wish to find a little piece of the store, of the big mosaic, to understand who we are as human beings. That's a very philosophical approach, I assume, but that was my first step into science. And then later on, when I started working as a doctor, because I'm a neurologist working with patients, and then I work with science 50%. Then later on, that shifted to a more practical approach, because then it was the patient in front of me driving my interest in science, and this feeling that I would like to find a therapy. I would like to answer that question. I would like to solve that problem. I would like to contribute to what I see as a problem in front of me. So I think now it's the patient's problem that is my driving force in doing science.
Extending that, if I could put you on the spot and give you 30 seconds, how would you describe your research in 30 seconds?
The research I'm doing is trying to find a way to stop or treat Parkinson's disease so that you don't have any symptoms anymore, but it's finding neuroprotective or neurorestorative therapies. So I'm interested in promoting the brain's own repair mechanism in different ways, and also finding cells that we can use to replace the dying cells in Parkinson's disease.
So just following on from that, if you had to place it in context, why is your research important?
Well, we know that in Parkinson's disease there are certain cell types that are lost, mainly dopaminergic cells. We still don't know the reason why people get Parkinson's disease. There are lots of hypotheses, but we don't have any treatment at the moment that is slowing the disease down or reversing the disease or stopping the disease. And I think that is, from what I perceive, the most important issue at the moment.
Extending forwards a long way, if you had to think about it, in your lifetime, what do you think Parkinson's research will have achieved?
It's difficult to know, because science is developing incredibly fast on one hand, and on the other side very, very slow. I do hope that if I have to live another 50, 60 years, we will have found a treatment to stop the progression of this disease.
If you had to define the word cure in the context of Parkinson's, what would a cure for Parkinson's be?
Well, a cure in the medical sense is basically that you cure lung inflammation by giving antibiotics, and then the disease is gone. So to cure Parkinson's disease would mean you give a treatment and the disease is gone. There's no progression of the disease, but there are also no symptoms of the disease. So in that case, you would have to replace the defects or give a treatment that is basically making all the symptoms vanish and not requiring a constant treatment.
In your research career to this point, what single thing are you most proud of? Is there a single piece of work, a single paper where you think, yep, that's the best thing I've done?
No, I wouldn't put it in the paper or anything. When I talk about pride in that sense, I think one of the things I'm happy for is that I'm able to connect basic research and seeing patients, and I really feel I understand both. I understand the experimental background, and I can understand the patients and the clinical problems, and I can run clinical studies, so I can really connect these two parts, and that's very unique, and that's what I'm proud of in the sense of competence, maybe. what I feel it's very important, and I don't know if I would use the word proud, but what I feel it's important, that I feel I can stay myself as a person, and I can kind of keep open, and I can still be moved by patients. I haven't worked so long in the field that I don't get touched by what I see anymore. Which can happen if you work a lot in that field, so I would more phrase it like that. Mm.
If you were to speak to the Parkinson's community generally, and by that I mean predominantly patients, but also carers, also physicians, scientists, but if you had a single message for the Parkinson's community, what would it be?
Not to give up hope, or to live life exactly to the fullest. I think that's maybe my message right now. Yeah. Because I sometimes experience in patients that when they get the diagnosis, they start holding back and start to worry. But I think there's so much research ongoing right now, and there's.
Looking back again on your research up to this point, if I could take you back to the point where you first started at medical school, with the knowledge that you have nowadays, if you just take yourself back to that point, what would you do differently?
Yes, maybe I would focus more directly on the path that I have chosen now. At the time when I started medical school, I had no idea that I'm going to work in Parkinson's disease. I was interested in lots of things in the beginning, and so maybe I would focus more and earlier on what I'm doing now if I had to do something differently.
We've known of the existence of Parkinson's disease. It was first characterised in 1811, if I remember right, 1817, sorry. So we're coming up to nearly 200 years during which the condition has been recognised and characterised, and we still don't have a cure. What do you think we've learnt about Parkinson's disease, and what do you think there is left to learn?
Well, from when James Parkinson wrote his essay on the shaking palsy, I think we have come a long way, even though it's interesting when you go back and read actually his essay, you find that he's describing non-motor symptoms that we're talking so much about already there. And he also describes the progression of the disease. And it's quite interesting to see how observant these old scientists were during those days. And but I think we have come a very long way. We have discovered certain factors that play a role in the etiology. We have discovered genes that are responsible for certain types of Parkinson's disease, or diseases that look like Parkinson's disease, because I believe that Parkinson's disease is a very heterogeneous disease. We have discovered levodopa, which is an immense step forward, and it's still our gold standard in treating Parkinson's disease. We have a large variety of other medications that we are using. We can treat dyskinesias much better. We have discovered DBS. We are working with cell transplantations. We have gene therapy in trials. I think we have come a very long way, and still there's a lot that we don't understand about the etiology.
Do you think new treatments or even a cure for Parkinson's will come from focused research on specific issues, specific components of the biochemistry, or do you think that we're just going to come across it by accident, that by serendipity? How do you see the future, the role of research in that development?
Well, serendipity happens in science here and then, and we have seen that many times. But I think the approach scientists take, and in that way I'm very much a scientist, is to find models, to model the disease and then test certain components. And that's a very structured way to go. But along that way, of course, it can happen that you suddenly come across a finding that you didn't expect. And then it's important to have an open mind and to see that finding, and not just to discard it because it doesn't really fit exactly with your hypothesis.
What do you see as being the role of patients in research, apart from being subjects in trials?
I think there's a change happening right now because patients getting much more of a voice, and they have very good knowledge. They're reading a lot on the internet. They're very informed about their disease and research. So I think also by raising funding for research, patients are much more in the position to influence what type of research should be done. And sometimes maybe we consider something important that the patient doesn't feel at all is important. And quality of life is it's something it's not always the same for each patient, and I think that's what we should measure in the end, is quality of life.